Can I take HRT when I'm over 60, 65? I get this question every single day. Women tell me that they've seen so-and-so, their doctor, etc., and they've been told that they can't take HRT for a number of reasons. They tell me endometrial cancer, they tell me the risk of breast cancer, and they tell me the risk of cardiovascular disease and stroke. So I want to address today this endometrial cancer. Endometrial cancer means uterine cancer. So is there a risk of endometrial cancer with the initiation of hormone therapy after 10 years of menopause? What does this data show? So we don't have a specific study looking specifically at endometrial cancer as an endpoint. So we have to extrapolate from what we have available. And the two biggest studies are the WHI, the Women's Health Initiative, and the Million Women Study. Now, in the WHI, as we know, they used a combination of conjugated equine estrogen and medroxyprogesterone acetate continuously. So they gave the women CEE and progestin to take continuously, so every single day. They showed in the data that there is no increased risk of endometrial cancer in women on combined continuous hormone therapy, even in women that were initiated on hormone therapy all the way up to the age of 79. Now you're going to say, well, Dr. Noor, that's conjugated equine estrogen and medroxyprogesterone acetate. And I hear you 100%. So the Million Women Study, which was an observational study, so, not as strong a study as the WHI, included the use of transdermal estradiol, the use of oral micronized progesterone, and the use of oral estradiol. It also shows that there is no increased risk of endometrial cancer in women who take combined continuous hormone therapy, meaning every day, so they take the progesterone every day, including women past the 10-year window. The other thing that's even more mind-blowing about all of this is that in both studies, there was some suggestion that there was a protective benefit with combined continuous hormone therapy for the risk of endometrial cancer, meaning it wasn't statistically significant, but there was a question of whether or not combined continuous hormone therapy decreased the risk of endometrial cancer. So when somebody tells you, and you're over 65, you want HRT, and they say, what about the risk of endometrial cancer? That is not a thing. They are misquoting data. That's not what the data show. There is no increased risk of endometrial cancer with the use of combined continuous hormone therapy in women past the 10-year window.